In over 30 years as a cardiologist, I've heard the same question from hundreds of patients. Doctor, which arm should I use to measure my blood pressure? The left or the right? I remember one crisp autumn morning, John, a man in his 60s, came to see me. He looked worried. Doc, he said, my right arm gives me one number. My left arm gives me another. I don't know which one's correct. The truth is, the answer isn't that simple. It's not always the left or always the right. Just like in life, if you only listen to one side, you might miss the full story. Step 1. Listen to both sides of your body. If you're checking your blood pressure for the first time, or it's been a long while since you last checked, measure both arms one at a time. A small difference, about 5 millimeters of mercury, is usually normal. But if the gap is more than 10 millimeters of mercury, it might be a signal from your body saying, hey, pay attention, something's not right. I once treated Linda, a 62-year-old woman, who noticed her left arm's reading was 15 millimeters of mercury higher than her right. We decided to investigate and found narrowing in her blood vessel caused by plaque buildup. If she hadn't measured both arms, we might have missed it. And a few years later, it could have led to a stroke. Why the difference? In younger people, it's often due to a muscle or bone structure pressing on a blood vessel. Something rare, but usually not too dangerous if caught early. In people over 50, the more common cause is atherosclerosis, plaque building up in the arteries over the years, making it harder for blood to flow. In rare cases, a large difference could be a sign of aortic dissection, a tear in the main artery from the heart, a true medical emergency. Which arm should you use after that? Once you know which arm has the higher reading, use that arm for all future checks. That's the approach recommended by major heart health organizations in the US, though sadly, many clinics don't consistently follow it. I often tell my patients, it's not about your dominant arm, it's not about which is closer to your heart, it's about the arm your body is telling you has the highest pressure. Measuring blood pressure, a conversation with your body, but like any conversation, you need to do it the right way. If you've just had coffee, smoked, or rushed up the stairs, your reading won't be accurate. Give your body at least 5 minutes of calm before you measure. Sit up straight, relax your shoulders, and keep your arm at heart level. The cuff should fit properly, covering about 80% of your upper arm, and be placed directly on the skin. When measuring, don't talk, don't move. Take 2 readings with a short break in between. If they differ by more than 5 millimeters of mercury, take a third. One patient once told me, Doctor, measuring my blood pressure this way actually calms me down. I smiled. Yeah, because it's not just about the number. It's a moment to pause and listen to yourself. If you're over 50, check both arms regularly. Even after you've chosen your higher arm, I recommend checking both arms at least once or twice a year. The body changes, and so do your blood vessels. If one day you notice a bigger difference, especially with dizziness, chest pain, weakness in your limbs, or shortness of breath, see your doctor right away. I've seen lives saved simply because someone paid attention to this small detail. Blood pressure, your heart's daily journal. I want you to think of it this way. Every number you write down is a sentence in your heart's journal. If you read it carefully, you can catch changes before they turn into serious problems. Picture this. It's morning. You're sitting at your kitchen table with a warm cup of tea. You wrap the cuff around your arm, take a slow breath, and the number appears. And you know you're doing something good for yourself, listening to and protecting your heart. So the question, which arm should I use to measure blood pressure, is really another question. How closely are you listening to your body? If you've never measured both arms before, try it. You might discover something important. You might even save your own life. Thank you for spending your time with me today and for caring about your health. I truly believe that small steps, like measuring your blood pressure the right way, can make a big difference in how long and how well we live. If this video helped you, please give it a thumbs up, share it with someone you care about, and subscribe so you won't miss the next time we talk about your heart and health. Until then, take care of yourself. Keep listening to your body, and I'll see you in the next video.